Idiopathic pulmonary fibrosis (IPF) is a type of chronic, progressive lung disease characterized by the thickening and scarring fibrosis of lung tissue. This scarring impairs the ability of the lungs to function properly, leading to difficulty breathing. The term idiopathic means that the cause of the disease is unknown. The exact cause of IPF is unknown, but several factors may contribute to its development. Genetic factors. Genetic predisposition may play a role, as some individuals with IPF have a family history of the disease or other related conditions. Environmental exposure. Long-term exposure to certain environmental pollutants, such as silica dust, asbestos, or other occupational hazards, may increase the risk. Smoking. Smoking is a known risk factor for IPF and other interstitial lung diseases. Autoimmune conditions. IPF can sometimes be associated with autoimmune diseases, though it is not classified as an autoimmune condition itself. Symptoms of IPF typically develop gradually and can worsen over time. Common symptoms include shortness of breath. Difficulty breathing, especially during physical activity, is often the most prominent symptom. Chronic dry cough. A persistent, dry cough that does not go away. Fatigue. Feeling unusually tired or weak. Unexplained weight loss. Losing weight without changes in diet or exercise. Clubbing of the fingers. Swelling or rounding of the fingertips and nails. Chest discomfort. The feeling of tightness or discomfort in the chest. Diagnosis. Diagnosing IPF involves several steps. Medical history and physical examination. Discussing symptoms, exposure history, and family history with a healthcare provider. Imaging studies. Chest X-ray may show changes in lung structure but is less specific. High-resolution computed tomography (HRCT) provides detailed images of the lungs and is more effective in detecting fibrosis patterns characteristic of IPF. Pulmonary function tests measures lung capacity and function to assess the degree of impairment. Lung biopsy. In some cases, a lung biopsy may be performed to obtain tissue samples for examination, either through bronchoscopy or surgical procedures. Blood tests. To rule out other conditions and check for markers of inflammation or autoimmune diseases. Treatment. There is no cure for IPF, but treatment aims to manage symptoms, slow progression, and improve quality of life. Treatment options include medications, antifibrotic drugs. Medications such as pirfenidone, esbriet, and 9-danadofov are used to slow the progression of fibrosis. Corticosteroids, sometimes used to reduce inflammation, though their role in IPF is limited and not always effective. Oxygen therapy. Supplemental oxygen can help ease breathing difficulties and improve oxygen levels in the blood. Pulmonary rehabilitation. A program that includes exercise, education, and support to help improve lung function and overall well-being. Lifestyle modifications. Smoking cessation. If applicable, quitting smoking is crucial. Healthy diet and exercise. Maintaining a balanced diet and staying active can help manage symptoms and improve quality of life. Lung transplant. For advanced cases, a lung transplant may be considered as a treatment option to replace the damaged lung tissue. Prognosis. The progression of IPF varies among individuals. While the disease is generally progressive, the rate of decline in lung function can differ. Prognosis depends on factors such as stage of disease, the extent of lung damage at diagnosis, response to treatment, how well symptoms are managed with available treatments, overall health, other health conditions or complications that may affect outcomes. Conclusion. IPF is a serious and challenging condition that requires ongoing management and care. If you or someone you know is experiencing symptoms of IPF or has concerns about lung health, consult with a healthcare provider for an accurate diagnosis and appropriate treatment plan. Regular follow-up and comprehensive management approach are essential for improving quality of life and slowing disease progression.